It is 8:16 and Dr. Art Mollen is here to answer some of your medical questions, like why are all my colleagues sick, Doc? What's happening?
Because it's going around.
Yeah, is it just the crowd or what is it?
It's moving fast. Yeah, it's probably influenza.
Oh,
yeah.
really?
And it's just traveling pretty quickly.
Oh, my goodness, the flu.
All across the country.
Okay, so we have a lot of questions.
I'm going to talk about that.
Yeah, I know
in a
one of the
minute.
questions about the flu. Okay, so let's start with our first question. This is Brennan in Tempe, and Brennan says, I'm 55 years old. I've had insomnia for the past 6 months, and I've tried melatonin and Benadryl for several months without any benefit. Do you recommend any prescription meds for sleep or anything else?
Well, you know, that whole field has changed. Now, when people have insomnia, and if it's an acute onset, physicians will often prescribe something like Lunesta or Ambien, and these are commonly taken, and they usually help for short periods of time, but they should not be taken for a long period of time. What they're using now are some of the antidepressant type of medications. They're called tricyclics, such as nortriptyline, amitriptyline. These are medications, trazodone's another antidepressant, and they use them in very small doses. So what I usually suggest when people have insomnia and it's been going on for the last 3-6 months, it's a new onset, they need to have a medical evaluation. Make sure it's not an underlying medical condition. It could be sleep apnea, get a sleep study, all of these things will help.
Okay, Doc. Let's talk to Molly. Molly is in Glendale. She's 36. She says, I've been taking biotin for healthy nails and hair for the past year. Seems to be helping. I take 10 milligrams and a multiple vitamin. Is that too much? Are there any side effects I should worry about with biotin?
Well, biotin is interesting because it's vitamin B7. The FDA has just come out with warnings that if you're taking biotin in extraordinarily high doses, and in most supplements they have about 10 milligrams, which is actually 300 times what you need, because micrograms are what it's measured in. So most people need about 30 micrograms, not 10 milligrams. So what you ought to do is make sure that you see your doctor. If you're having blood tests, it can change blood tests. They can be higher or lower. For instance, you may be diagnosed with a thyroid problem, and you may not really have it because the biotin is changing the laboratory studies that you're getting. So the FDA came out with serious warnings on biotin. Be careful. And all of the scientific evidence is pretty weak regarding the benefits of biotin as far as nails and hair.
Okay.
Yeah.
All right.
Yeah.
Interesting, though.
And
That you can mess up your medical.
Yeah. And you can get lots of that in your diet. Egg yolks have lots of biotin, and you know, nuts have biotin as well. Okay.
Next up, Cindy asks, here's our flu question. How long does it take for our flu shot to become effective? How effective is it this year in preventing the flu? That's Cindy in Phoenix.
Well, it takes, first of all, about 10 days to 2 weeks to actually prevent influenza. You may get some immunity in a week, but usually about 2 weeks for the antibodies to actually start to work. But it's been suggested that this year's vaccine is only 10% effective against influenza. So that's exactly why a lot of your colleagues are starting to get influenza now, because it's really, even if they had a flu shot. However, on the other side of the coin, get the flu shot. Even 10% is going to be effective. If you do get influenza, you can take something like Tamiflu, which is an antiviral drug. It shortens the duration and the severity of influenza should you contract it.
All right, Doc. Next up, Dr. Art. Don says, I've tried over-the-counter weight loss products without success. Which prescription meds do you think would help me lose 50 pounds? Yeah.
Well, first of all, I cannot underscore the importance, and again, and I've said it once, I've said it 1,000 times, it's exercise and diet at the end of the day, because you need to change your lifestyle. Now, there are medications that can help weight loss. One is called Contrave, one is called Qsymia, and the other is Belviq. These are newer types of medications that have been around for the last couple of years. I don't like the ones that actually contain phentermine. Phentermine is in Qsymia, so that's one that I probably would eliminate because it's an addictive drug. And you only can take these for about 3 months, and if you don't lose at least 5% of your body weight during that period of time, then doctors will usually not continue on that type of medication. The one I like the best is probably Contrave, because it contains a medication called naltrexone. Naltrexone is basically used for drug addiction, and it contains Wellbutrin, so it's a combination of a couple different drugs. But at the end of the day, if people don't follow an exercise and diet program and change their lifestyle, they're not going to benefit from any of these types of weight loss medications.
Why are you looking at me when you say that?
You don't need You're beautiful. You don't need weight loss.
Salmon salads and water and exercise.
Yeah,
The things Dr. Art lives by.
You look great. You look great,
Thanks,
Jamie.
Doc. All right, well, if you have a question for our fabulous Dr. Art Mollen, you can email him at askdrartmollen@gmail.com. Thanks, Doc.